certainly things have moved on, and what we're seeing now is that we're treating far more complex disease, more bifurcations, more calcifications, more chronic total occlusions. The amount of equipment that we are using on a regular basis in our standard everyday practice has gone up exponentially over the last 10-15 years since I've been practicing. So we're not really allowed to have any increased risk or any increased adverse outcomes for our patients, despite this increase in complexity and demographic or aging of our patients. Device trapping is part of my everyday practice. So what I am very methodical about is keeping wire hygiene, or keeping wire position. Sorry, I almost joke about wire hygiene with my trainees, but it's an ability to keep a wire where you want it when you're exchanging different bits of equipment. So the way to do that safely is to use a trapping device. We used to historically use docking wires, but that is a very historical way of trying to control the wire, and it really didn't control it. I used to find it difficult and challenging to use them, and that's the reality. They are difficult and challenging. So having a dedicated trapping device which reliably controls your wire, allowing you to exchange equipment effectively, efficiently, and safely is really the way forwards. So if I'm going to use a trapping technique and I just use a standard balloon, there are many times, certainly in patients with large BMIs, where you just cannot visualize that balloon, and you will migrate out into the left main or into the ostium of your right coronary artery, potentially causing dissection. And the trade-off is increasing frame rate, increasing radiation, increasing risk for me as well as the patient. And if we have a device that can avoid us having to screen or worry about where this trapping is going to occur, it's absolutely crucial for helping us deliver safe care.
Different than regular balloon catheters, TrapIt is designed for the trapping technique. First of all, TrapIt is very safe. This means that the autostop is designed in such a way that it prevents the tip from migrating outside the guiding catheter. So this prevents damage inside the coronaries. Secondly, TrapIt will always keep its pushability due to the core wire design, which is connected all the way from the tip to the hub. Even after many inflations, it is easy to enable the device and insert it inside the guiding catheter. And of course, the purpose of TrapIt is to trap other devices. Therefore, the profile of the shaft of the device is kept very small, only 2.0 French. So it means that there is quite some space left inside the guiding catheter. So even in a 6 French guiding catheter, there's no need to worry about fitting with other devices.
So having that dedicated device allows us to focus on the real challenge of that case. It allows us almost to forget about us trapping, and allows us just to make sure that actually we're doing the right thing for our patients and making sure that we can do it reliably. That reliability of a dedicated trapping device means that actually we don't have to worry about that part of the procedure. It simplifies things.
Not only the simple autostop design of the TrapIt makes the TrapIt very reliable, but also the high trapping performance. In this test results, you see that we have been testing the trapping forces, so the forces needed to trap guide wire inside the guiding catheter, and the TrapIt is resulting in the highest trapping performance versus other regular balloon catheters, but also versus other dedicated balloon catheters. This is due to the lack of hydrophilic coating and the material of the balloon.
So thank you for explaining that. It really does help me understand why, when I'm using this device, I hardly notice it within a guide catheter. It doesn't really take up any real estate. It's the reliability to compare to other dedicated trapping devices, which you've demonstrated in that slide, is quite profound. And it really explains why I find it as a device so very useful, so very reliable, and so very safe. Everything, even despite complexity, falls back to being safe, effective, and efficient. And what we have here with TrapIt is a thoughtful, well-designed device which helps me in my practice deliver best care for patients. And it takes much of the hassle out of the necessary steps in delivering a complex procedure. It takes only a little time to use, it can be safely inserted, and I'm confident in its reliabilities in my procedures.